Hi, my name is Ben Sommers. I'm an assistant professor of health policy and economics at the Harvard School of Public Health and also a primary care physician at Brigham and Women's Hospital here in Boston. This is a great question, the impact of the Medicaid expansion on healthcare providers. And it's something that's near and dear to my heart. When I'm not doing policy research, I work as a primary care physician in a community health center, and it's a real issue of how the reform will affect providers. So the first thing I think that's really important to focus on is that right now there are providers across the country, individual doctors, practices, and hospitals that are caring for patients who are uninsured, or patients who have flimsy private coverage that often leaves them with large cost-sharing bills that they can't pay. And to the extent that any provider has a lot of bad debt or uncompensated care now, they're going to be much better off when their patients are by and large enrolled, either through Medicaid or health insurance exchanges. It'll make it much more consistent, their revenue stream for the care they provide. Now, there are providers who are going to see a change because right now they're primarily caring for people with private coverage or Medicare, and now they're going to have a higher number of patients with Medicaid. And Medicaid reimbursement is, across the country, lower on average than for those other two types of care. So that is a real issue for some providers, and in part to help deal with this, one of the features of the health reform legislation is that the Medicaid reimbursement rates for primary care is going to be bumped up and match the Medicare rates. For the first 2 years, the federal government is going to pay for that full bill to try to lift up the reimbursement under Medicaid and make it a little more practical for providers to provide that care.